friends. So in today's email, we're talking about triage and what that looks like for the average woman going into labor and delivery. So once you go beyond a certain amount of weeks, like 20 weeks for most places, sometimes it's 16 weeks. It really just depends on the policies and protocols for your hospital. You'll automatically go through to L&D and be triaged there versus going directly to the emergency department. Now, if it's like a major trauma or something like that, like a car accident or, God forbid, or something traumatic, then they would first triage you down in like trauma or the ED and then send you to labor and delivery. But because you're pregnant, the most of the time you're going to go to labor and delivery. So triage is where they evaluate you. They'll get your vitals, they'll check on the baby, they'll maybe run some tests and all of the things. But what most people don't know is you don't always stay in the hospital because you go to triage or they send you to L&D. Sometimes the doctors and midwives just want to work you up and make sure that everything's okay. If everything's okay, they'll send you home. If they're wavering a little bit, maybe they'll admit you for observation, and then sometimes they'll just go ahead and straight up admit you. Now, you may be asking, Rainey, what if I'm in labor? Surely if I come in having contractions, they'll admit me. Not always. So there are oftentimes when there are scenarios where patients do go home and it's expected. I've seen women come in who think that they've broken their water when really it's just either vaginal discharge or they've peed on themselves, right? And it's kind of hard to know when you have a baby that's 7 or 8 pounds sitting on your bladder, whether that's like water from your bag of membranes or whether or not that's just urine. So in any case, you don't want to take that chance. You want to make sure that you come in to be evaluated so we can make sure we know what's what. And yet and still, sometimes you're in triage because you're having those contractions, but the contractions aren't strong enough nor frequent enough to make cervical change. And so they may send you walking for a couple of hours and or they may just go ahead and send you home and say, you're only 2 centimeters only. Don't listen to them with that word. But they want to admit you in active labor, which is 6 centimeters and more. So you may go home, continue to labor there until you're more active. So if this helped, make sure you stay tuned for more videos, but we talk about this in more detail in our triage module at the Academy. All right, I'll see you guys in the next video and the next newsletter. Bye.